Здравствуйте, друзья! Я сегодня перевел вам видео Джонатана Каттнера о грушевидной мышце, о средне-ягодичной мышце и о подвздошно-поясничной мышце, о методах диагностики поиска триггерных точек в этих группах мышц и о том, как вообще с ними работать. Перевел я это видео по пожеланиям подписчицы, подписчика. Я вам скажу то, что если вы не с первого раза поймете то, о чем тут говорится, ничего страшного, это нормально. Потому мы приступаем. Поехали.
Examine for these points. You need to actually press fairly deep. And in somebody who has a relatively small buttock, you can use your thumb or your fingers and dig in. You see how deep I'm going to really get down to the piriformis. And with somebody with a really big muscular or plump bum, sometimes to get down there, especially if you've got a small therapist, you may actually even need to use your elbow. So I can go down, I press, and now we're going to do ischemic pressure, and I focus down, press until, and the muscle runs in this direction, so my movement is that way, seeking for the feeling of tight bands, which may be quite difficult in such a deep muscle, but I'm going to be watching his face and I'm going to be listening. He's going to give me feedback as to whether it's sore. Once I'm down there and I focus in, there's a little deep swelling. You can use one finger on top of the other to get down that far. Use your thumb, support your thumb. It's this kind of pressure that can injure people who do a lot of manual therapy. So this you need to be really careful while you're doing this, especially when you're down there and now you have to apply ischemic pressure, put enough pressure to cause the pain, then reduce and gradually increasing pressure. It's that injures hands. So be aware that this kind of treating this kind of deep muscle is potentially problematic for you as a therapist, and therefore it's not a bad thing to go to something which is much more robust. And as long as you're fairly gentle with the use of your elbow, you can get in and you just ask and you watch and you say, how does that feel? And once you find it, you can vary the pressure of your elbow perfectly well to treat deep buttock triggers. The principle of stretching this muscle, there is a complexity here because it's a fan-shaped muscle. So part of the muscle, the primary reason for the muscle to act is that when it all contracts together, it will support this side. It will stop your pelvis from dropping down, or it will pull your leg. Can you straighten your leg? It will pull your leg up like that. So if you hold there, that particular movement, which is in the straight line of the body, are the gluteus medius and minimus working together. However, because it's a fan-shaped muscle, this part of the muscle will tend to pull up and back slightly. This part of the muscle will tend to pull up and forward. So therefore, to stretch the different parts of the muscle, you need to actually move your leg either in front or behind the plane of action. Now, what I've done is I've put his hips underneath a pillow, which just allows a little bit more stretch, just more efficient. So, having done the cold, you just bring your arm over as a balance. Thank you. And we now bring his leg forward over the bed and having done one, do another, run the cold over, and then, so that's the stretch for the triggers at the back of the gluteus medius and minimus muscles. If it's a stretch in the, and then obviously follow with heat. If it's a problem in the front, then you bring your shoulders forward and you drop your leg over the other side. So come like that. Can you come over a little bit more? That's lovely. So we're stretching in the long axis of the body, leg going back, hanging over the edge of the bed, and now I'm stretching the front part of the gluteus medius and minimus muscles. And you know which one you need to stretch because obviously you know which triggers you've actually treated. Finally, I put heat on, and I put heat on the muscle and in the plane, in the zone of pain radiation. So if it was these triggers, I put it like that. If it was the triggers at the back, I would lie him on his tummy and put the wheat bag like that, and then follow with a stretch. And always he would continue doing stretches at home as part of a home maintenance program. Trigger is where the psoas muscle arises from the vertebrae, and this is because this is incredibly deep. You can see where I've drawn it. Here's the 12th rib. Here is the lateral board of the rectus abdominis, and the trigger sits about equal to the belly button, or maybe a little bit higher or a little bit lower. And to get to the psoas muscle, you need to come around the edge of the rectus abdominis, and you need to push towards the midline. There are a number of structures deep to here, which include the abdominal wall and the gut and sometimes the liver. So you need to be gentle with your palpation, and it needs to be very deep. So with your patient lying on their side, that tends to relax the abdominal wall the best, and I carefully move down, making sure that I'm not hurting. So I look for feedback from my patient, and I gently palpate down as deep as I can, and right at the limits of this palpation I will be hitting the psoas muscle. If there's tenderness here, it could be bowel, it could be one of the other structures. So the question is, how do you work out whether it is bowel or not? And there is a maneuver that you can do. So I'm pressing down, and he says, ouch. What I do is I flex his thigh to take pressure off the psoas muscle, and then I rotate up towards me, and in so doing, what I'm doing is I'm unwinding the psoas muscle. And if the pain goes when I do that, and as it rolls back, and as I straighten his leg out, the pain comes on again, then that's psoas muscle. There's no other structure that in this area that would be influenced by movement of his thigh. The second trigger is from the iliacus muscle, and here is the anterior superior iliac spine, the final bump of the iliac crest, and the trigger sits inside. So if I again just flex his leg a little bit and I get him to relax, I'm curling around and I'm pushing directly in here. Again, this is a tender area, and the trigger lives just there, but you're pushing in to get there. Again, there could be bowel, there could be abdominal wall, and again, if I flex up his leg, I'm taking pressure off the iliacus, and again, if I do a hip rotation, I can unwind the iliacus muscle. And the final trigger is just over near the insertion of the conjoint tendon into the femoral bone. So it's in your groin, about there. And this is deep. So apart from this trigger point here, which is relatively superficial, the other two trigger points are very, very deep structures. If these triggers are active, then the pain is perceived running down through your groin and running down your thigh. To find the trigger point of the tibialis anterior, you feel for the tibia itself, which you can feel as your shin. The trigger point is usually 2 to 3 fingers down below the ridge of the lower part of the front of the tibia. You can feel that little ledge, just go below it. That's about where the trigger point is, and it's quite close to the free edge of the tibia in this area. You run your finger backwards and forwards because the long axis of the muscle is like this and the fibers are running this way. You feel for the tight bands that occur with triggers. Once you've found a tight band, like a little guitar string underneath your finger, you search for a little thickening. He's going to tell me, so he'll actually tell me whether that's sore or not. Once I'm on there, I lift his foot up just to take the tension out of the muscle, and then I bend one finger over the other, search for the point. Once I've found it, I reduce pressure and use ischemic muscle principles.
Поздравляю, вы закончили видео. Я тоже вместе с вами его закончил. Желаю вам успехов, и чтобы не было ни триггеров, ни эмоциональных, ни физических. Спасибо за просмотр.